Welcome everyone in whatever time zone you're in. My name is Beth Outerson. I am a board member of the CORE group and I've been involved with CORE for many years. And social and behavior change is near and dear to my heart. And so I'm really excited to be moderating / facilitating this session for you today. This is a marketplace session on the topic of social and behavior change. We've got 3 fantastic presentations for you today. The way that the marketplace works is that each presentation is 20 minutes each. So for each of these presentations, we'll have speakers, and then that 20 minutes actually includes questions. So we'll have, for each of our presenters, they will be timed. And if you have questions, please put those questions in the chat box. That will facilitate you getting an answer to your question before the 20 minutes is up. Okay, great. So let's start with our first presentation. We have Claire Boswell, who is the Senior Technical Advisor at Food for the Hungry, and Lauren Woodside de Alegre, who's the Risk Resilience and Humanitarian Response Manager for Food for the Hungry. The title of their presentation is Early Warning for Early Action Toward More Behaviorally Informed Early Warning Systems.
Hi, everyone. This is Lauren, and we're really glad to be presenting this here with you all today. Much of what we're presenting is taken from some research that we have done, that FH has done in the last couple of years with the REAL Award. And it was published just recently, even though most of the research was done earlier, but it was published recently. And I'm gonna put here in the link, in the chat, sorry, a link where you can download the full research that we did. And we're continuing kind of, it's a first stage. So, Claire, let's go ahead and move on and we'll let people get started. So we wanted to start with a case study for you to go ahead and read. So we're going to give you a moment to read this, and then we'll see what you think. Okay. Can you move on to the next slide, Claire? That was enough time for everyone to read. So we wanted to start with a question, and you can just answer your response in the chat. What do you think Gallo should do? Should he sell his cattle and save the money to try to rebuild his herd after the drought? Should he sell his herd and migrate to the city in the hopes of finding a job? Should he trek farther for water and pasture and hope that the information that was shared on his friend's cell phone was accurate? What do you think he should do? And you can go ahead and respond in the chat. Just want to hear what you all think is the right answer. I see lots of different answers, although I don't think I've seen anyone think that B is the right answer. So this predicament, this situation that Gallo has found himself in is a situation that FH sees frequently in our work in Northern Kenya. We've been working in Northern Kenya for over 20 years. And this issue of how drought early warning systems in particular can inform early action decisions is something that we've been trying to address for some time. And what exactly are those actions? And it's something that in the world of disaster risk reduction, really looking at that kind of end user action at a much more detailed behavioral science perspective is not something that early warning systems in general have considered. So when the real award came about, it seemed like an interesting opportunity for both our risk and resilience unit, which I'm a part of, and our SBC unit, which Claire is a part of. We joined forces and thought, okay, how can we apply behavioral science to this context and these issues around risk reducing behaviors in stemming from early warning systems. So can you move on to the next slide, maybe, Claire? So one thing I think that's maybe helpful for all of you, if you're not super familiar with kind of the early warning system background, the point of early warning systems, of course, is to lead to early action. And when early warning systems first kind of hit the ground, when the world said, yes, we need to have systems to help us know when there's hazards coming and how we can act and help advise, there was significant focus around the information and the technology around information around the hazards and judging when the hazard was coming, how strong the hazard or the magnitude of the hazard. There's been lots of work around that angle of early warning systems. And over time, there's been an incorporation of different people-centered aspects of early warning. So right now, kind of the framework that you hear frequently among resilient circles is this idea of, so you have, starting with the early warning information, leading to early warning messaging, and then some sort of preparedness actions, perhaps, and then ultimately resulting in early action that leads to reducing the risk or the impact of the hazard itself. Can you go on to the next slide? Well, actually, I guess that I'm still my turn. I know what the next slide is now. So this, though, has still not been enough. We've seen time and time again that even though early warning systems are people-centered, they're still, in many cases, not leading to actually action or the right action or a mitigating action by the population that's being impacted. And a lot of times the early warning system is informing policy decisions among governments or NGOs and decisions about response, but they're not leading to action by populations to actually reduce risk. So this is kind of where some of our research came into, and I'm going to let Claire share more about that.
Right. So the question we had is, how can we take what we know from social behavior change and those approaches that we use generally in the development space, but not always, and apply them to this concept of early warning system. And what we saw in our research, we did a pretty comprehensive literature review, was that most early warning systems focus on the hazard itself. There's a lot of emphasis on risk communication. And sometimes it's so much focus on the hazard itself that there won't be any emphasis at all or even a mention of an associated behavior. So I put this lovely little graphic, which those of you who've lived in the US for the past 20 years will recognize. This is from the Homeland Security Office in the US, and this was put in place after the 9/11 terrorist attacks. And so there's threat levels. There's a severe threat warning for a terrorist attack, or we're in orange alert, but there was very rarely, if ever, a mention of any action that we as the general public could do, unless you count lying awake at night and worrying as an action, and that's generally not considered to be a productive one. So unfortunately, this is how a lot of early warning systems have historically functioned, and many of them still do function. And so what we see very clearly in the literature is that risk communication is not bad. It's important, it's a critical piece, but it is never enough. We have to focus on a behavior, on an action that we want people to take that could be helpful in mitigating or even preventing the impacts of what the disaster is. So we tweaked what we saw as the typical early warning system framework and developed a new one. And for those of you who are familiar with social behavior change, you'll be very comfortable with this sort of language. And the very first step, the one that most early warning systems are not doing, is to identify what those early actions are. What are those behaviors that we want people to take? And then what are the determinants that lead to those behaviors? And we did see in the literature, which of course we don't have time to share today, but we highly recommend that you dig through the paper. We'll see some of the most common determinants when you're talking about early warning and hazard specific actions that seem to float to the top to be more prevalent in a variety of situations. And then condensing that, okay, what information do people need to do these actions? How do we frame the messages? And how do we support people to actually do these behaviors, which is another piece that you frequently do not see in an early warning system. And then of course, the monitoring, evaluation, and learning. So I will stop there so that we have enough time for questions. That was a very, very brief overview of a lot of research that we did. So we'd love to hear from you now.
So this is Beth. I just wanted to say that's 10 minutes. So that was a nice roundup of important information in a short amount of time. So we do have 10 minutes remaining. If anyone has questions, please type them in the chat box and then I'll read them.
And if you don't have questions, we have a couple of discussion questions. If we could get input from you, we'd love to hear your experiences as well, your thoughts on this topic.
I'd like to know a little bit more how you came up with the circle, the components of the circle a little bit more. I think I wasn't listening as closely as I wanted to because, you know, like the community action cycle, how communities go through behavior change. Did you look at community models or did you look at individual models for behavior change?
So what we really did is we looked at the models for early warning systems. And so this is traditionally what you see. It's just, as Lauren said, it's just that focus on the information. What is the information about the hazard almost always? And then what technology do we use to get it to people? And then the assumption is that, you know, if they have the information, they'll just do what they need to do. Sort of, you know, sprinkle a little magic fairy dust. I'm being a little overly critical. They're not, as Lauren said, the effort to make them more people-centered has really come a long way. So we tried to take that framework and tweak it. So this is not really a behavior change model. It's more a model for how to incorporate a social behavior change perspective or lens onto the early warning system framework. So encouraging early warning system designers and implementers to factor in these SBC components. You know, what are the actions that we want people to take and what facilitates those actions and what are the barriers to those actions? And then steps 2, 3, and 4 are really about, you know, the activities that we would do to facilitate or, you know, reduce barriers to those actions.
Excellent. Thank you for the explanation. So we have some questions here. Let me see. Paul Fast says, can you give an example of what each of those steps look like in practice, the ones on your chart?
Oh, that's a good question. So we are actually working towards this in our communities in northern Kenya, and we're starting with the first step. So northern Kenya is actually one of the most difficult areas to implement a good early warning system because exactly what you saw in the case study, the early actions are not clear. So this is not a situation where it's a rapid onset weather-related hazard where we want people to evacuate or something along those lines. It's not exceptionally clear. So what we're doing right now is preparing to do some exploratory, participatory research in the communities in northern Kenya. We've obviously, like everyone else, been severely delayed by COVID, but we want to kind of find out what are the potential early actions for people in these communities based on their different situations, and then looking at, okay, what are those behavioral determinants? And many of you are familiar with that term, but if you're not, it's you know, what are the barriers and what are the facilitators? What makes it easy? What makes it hard? How, you know, what affects people's ability or desire to do those behaviors? And then you would wrap that into the early warning system. So what is the information that people need? If it is information that people need to do these actions, and then how can we get that information to them? That's the messaging piece. So, in a place like Northern Kenya, in our case study, Galgalo's brother or his friend, I can't remember, had a radio, but maybe not everybody has a radio. So you have to look at what are the best ways for disseminating this information? Is it through, some elders, or do people have radios, or do people have cell phones? In Northern Kenya, the answer to those questions are no. So you'd have to use more traditional systems of getting information out. And then in the step 4 is really, how can you support those actions? So this is more of, looking at the enabling environment. What are the opportunities? Maybe social opportunities for women to take action are inhibited by, the gender norms or something. So you would have to look at, what can we work on here? How can we make this easier? And then of course, getting feedback. A lot of early warning systems don't allow for feedback from the end user. And we've seen in the literature how critical that is. When systems do that, it's really useful. Lauren, did you want to say anything else? You know the context better than I.
I think one thing I just want to highlight for this group, especially since you probably are all much more social behavior change sensitive, the predominant perspective in the early warning system community is very tech heavy and from a very technological perspective. So I think one key thing about this framework is how we've emphasized that the first thing that has to be done is IDing what those early actions and their related behavioral determinants are. Like, what is it really that's going to help people have longer term resilience? Like, what are those better options? And so I think that's really key, because that's not how, in general, I would say the disaster risk reduction and resilience related to that are really thinking. They're not thinking starting with the behavior, they're thinking starting with the hazard and how much technological information or tech information around hazards can we collect to predict better when they happen, So, and that's those are all really important, but it's not enough.
Thank you very much. I'm sorry, we've already met our 20 minutes. We did have some great comments and questions. One was about how would you modify this for adolescent behavior and COVID. So I'm sure that when you review these comments later, you can write back directly to those folks, or at least ponder them for maybe a future presentation. So thank you very much. You can do a little hand shout out here to thank the speakers, and we'll move on to our second presentation. So I'm going to go ahead and introduce for the second group. The second presentation is called Integrating Responsive Care and Early Learning Content in Infant and Child Feeding Counseling Packages to Improve Early Childhood Development. And we have 3 presenters. Our presenters are Ramila Karnati, who is the Early Childhood Care and Development Advisor for USAID Advancing Nutrition at Save the Children, Andrew Cunningham, who is the Social and Behavior Change Specialist also for USAID Advancing Nutrition at JSI, and Medina Olomi, who is the Early Childhood Specialist for USAID Advancing Nutrition. And I don't have the organization that you're at, Medina. Are you at
USAID Advancing Nutrition? That's where we are.
Okay, excellent.
Thank you.
Right.
Good morning, good afternoon, good evening, and welcome to our marketplace session on an addendum of responsive care and early learning content for infant and young child feeding counseling cards. As Beth mentioned, I'm Ramila Kanati, an ECCD advisor, and I will be joined by my colleagues Andrew Cunningham, a social behavioral change specialist, and Medina Olomi, an ECD specialist, and we are all from USAID Advancing Nutrition. I'd like to first begin with what is the Nurturing Care Framework. Could we go to the next slide, please? So the Nurturing Care Framework was launched in 2018, and it really essentially is a framework to promote optimal care for holistic development for all young children. And by that, we mean the key components of the Nurturing Care Framework is good health, adequate nutrition, safety and security, responsive caregiving, and early learning opportunities. I'm sorry, Mona, make sure you could see the slides, or are you seeing a current slide and a next slide? Oh, there is a thing to make the slides bigger. I'll just...
yeah, if you can show
I'm
one
not
slide
sure. I'm not sure why it's showing both of them at the same time.
Do we want to go off and just connect it again?
Yes. So
actually, you can go to display settings. Sorry.
And
yeah, you can
yes,
you can you can put the slideshow. Yeah, just click the slideshow, and then you go to display setting on the top. Yeah, you can click that, and then you duplicate the slideshow. Yeah.
Perfect. Thank you.
Is this better?
There we go.
Okay, so again, just to repeat, the 5 components of the Nurturing Care Framework is good health, adequate nutrition, responsive caregiving, security and safety, and opportunities for early learning. And these 5 essential care components is what's necessary for all children to thrive, to reach their developmental potential. A second key component of the framework is this enabling environment. And by that, we mean an environment where you have supportive policies and services, you have communities that are empowered, and more than all, you have caregivers whose capacities are built so that they can promote that responsive caregiving behaviors at home with their young children. And all of this leads to that optimum brain development and child growth that we seek. Another component that is in the framework and critical is the universal progressive model. And essentially what it is that it strives to see that all children receive and caregivers receive care and no child is left behind. So the universal model is one where there are foundational services for all caregivers and children. And as you go up, there are more highly specialized services indicated for caregivers and children, especially children in special needs or have developmental delays and need more specialized services. So what we do know for the most part that in the first 1,000 days, caregivers and families and children are receiving health and nutrition services, but the responsive care and early learning components of the nurturing care is a gap. And hence, this was an opportunity for USAID Advancing Nutrition to look at adding counseling cards on responsive care and early learning as an addendum to the most widely used infant young child feeding nutrition package. So with that, there was a synergy between nutrition, social behavioral change, and ECD that resulted in this addendum. And I will now hand over to my colleague, Andrew Cunningham, who will walk us through the process in which these cards were developed. Go over to you, Andrew.
Thank you very much, Ramila, for that background. Yeah, as Ramila said, we really wanted to leverage platforms that maybe have focused on the nutrition and health components of the Nurturing Care Framework and sort of expand that and really leverage those really large platforms, particularly in packages like the UNICEF CIYCF package. So beginning in year 1, USAID Advancing Nutrition, identified this opportunity and started drafting some simple counseling cards based on the other 3 components of the Nurturing Care Framework. But we really soon realized with so many sectors coming together and the fact that we were building off of materials that we didn't actually develop, we really sought the technical support from a group of experts with really diverse perspectives. So this technical advisory group was formed to strengthen the addendum, gaining perspectives from ECD, nutrition, SBC, through media, people from academia, UN agencies, implementing organizations, development and humanitarian contexts, and in particular representation from lower and middle income countries. We got this group together and set them to honestly to take our content and pull it apart, to review it, really make sure that we were getting the right messages, the right content that made sense for typical audiences of counseling of IYCF programs, while also remaining proximal to that content. So we did 3 rounds with some targeted follow-up to ensure that our revisions were based in evidence, they capture the diverse perspectives of the tag, and were also aligned with the consensus of the whole group. And we ended up with a version that had fantastic consensus, which honestly I think is maybe the biggest point that I want to make from this presentation. Considering that we had people from so many different sectors, the fact that we were able to build consensus and get really positive results from our tag and a clear way forward with this content really shows and identifies the need for integration of IYCF and other components of nurturing care to really, for maximum effect through this SBC communication counseling medium of IYCF counseling. So what do we have? We'll go next slide. So what we ended up with was a set of 7 cards focused on different areas, mostly in responsive care and early learning. So we can see we have introduction to responsive caregiving, the responsive feeding, again, remaining proximal to IYCF content, and then moving into some of the early learning content of early communication, learning through play. And the last 3 cards were some of the ones that gained the most input and changed the most as a result of the technical advisory group, where we are encouraging caregivers to seek help if you're concerned about your child's development, to work towards understanding developmental delays and possibly identifying emerging disabilities. Card 6 is caring for the caregiver, which is aligned very much with UNICEF's upcoming guidelines promoting caregiver mental health, understanding that a caregiver that is properly able to give that care to children is really important for child development. And then also a special circumstances card to address feeding difficulties that may or may not be a result of developmental disabilities. Next slide. And so this slide is just an example of how our content is organized. We had a big challenge of going through so many different areas of child development and the many different ages and milestones that might be addressed within the 1,000-day period that matches our IYCF content. So our tag really helped us organize this into some really basic key messages at the top that might apply to the topic to all caregivers of all children in this age group. And then later on, the second half in somewhat gray are the practical tips that are organized by age group and are peppered with references to developmental milestones that model positive parenting practices, particularly praising young children. A lot of our tips are oriented towards how you can do these practices and use these concepts during feeding times. Again, keeping things proximal to IYCF content. While the tag and our team decided not to prioritize safety and security component of the nurturing care framework in this, which is why it's responsive care and early learning, a lot of the content we originally developed is integrated into those messages, making sure that areas are clean, that children are safe and well cared for at all times. And then we also really aimed to display gender parity in both caregivers and in the children being referred to in this content, which we'll be reflecting in the illustrations that will go on the other side of these counseling cards. So right now we're at the stage of having developed all of this content, and in this year, we're working on developing the other pieces, the other materials that will go along to make this a full package to align, to be used in conjunction with an IYCF program. And we're currently looking for opportunities to pilot this program in the future. So thank you very much. We're going to turn it over to Medina, who is going to take us through a very short video exercise to understand some of the crux of responsive care.
And this is Beth. I want to say you have about 9 minutes left in the presentation.
Okay, thank you, Beth. So thank you, Ramila and Andrew, and hello, everyone. We'd like to play a video for you now showing a caregiver-child interaction and encourage you to pay attention to the interaction taking place. We'll then ask you to share any reflections you have after the clip, along with opening up the space for any other questions or comments you may have. So just bear with me one moment as I share the video.
Aka. Aka. Nana. Nana. Aka. Nagati. Nana. Nana. Obonya kandi. Aka. Aka. Ba. Baro. Waibonye. Ba. Ni ba. Bari ba. Bari ba. Ni ba. No. Inga. 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 Imka. Iba. Imka. Iba. 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 Abo. Aibonya. Iba. Ako. Ako. Akaponye. Atandi. Inga. Inga. Ai. Nyoni. Nyoni. Sirihe.
Thank you, Medina. I'm sorry, I know the mother didn't always come into the frame, but that doesn't really matter at all. And I know perhaps you didn't understand the language, so did I, but that also did not matter at all. What we want to get from you, and by showing this short video, is this caregiver-child interactions. And I want you to just raise your hand and just let me know what in this caregiver-child interaction that you saw really moved you. Did anything about the interaction that you can describe connected with you? You could raise your hand just to share your reflections on this short video. Don't worry about the language or understanding the back and forth that happened. Would you like to just go off mute, or you prefer to raise your hand? Sorry, so there's Karen there. Sorry. Karen says that was really good serve and return. She repeated what he said several times, and he also repeated what she was saying. Exactly, Karen. That is the crux of that responsive care. And we really did not need to understand the language, but you felt that you could see that interaction, that responsive interaction. When the child said something, the mother said something back, or when the mother said something, the child said something back. And it's that back and forth interaction, which is really what responsive caregiving and responsiveness is. Parent did not scold and let the child lead. Fantastic, Beth. That is what describes a good responsive care interaction, which is child-led. Perhaps you didn't get this, but if you watch this video again, you will see that this child, who we call Lucky and is adorable, keeps moving back to the cover page. And as you can well tell, that the mother knows we are videotaping this interaction, and you would want and expect to just finish the book you know, you're being videotaped. I want to get through with the book. But the mother followed the child's cue and went back to the cover page over and over again. The cover page was brought back in front. So that is another great insight of how to be responsive, is to follow the cue of your child and aptly and appropriately respond to that cue that's coming from your child. Prince says this is useful for language development. Absolutely, absolutely. The pointing, that is so much a part of early communication. You do not need to have your words. You do not need to have that is very much an integral part of you know, early development and communication. I want to say, oh yes, love that, Kelsey. The sitting at the same level of the child, that is also so important for being responsive. You need to have that eye level contact. You need to make sure you and your child are in connection, and that back and forth interaction or responsive caregiving happens. So I appreciate all these reflections. They were spot on and really brought to life what we're trying to demonstrate to this video about what it means to be responsive. So with that, I'm going to move us to our question and answer session. We could take questions from the chat. I think my colleague Andrew is going to answer the first question, which was posed earlier in the chat. Over to you, Andrew.
We have a question from Shamia Nazir saying, did you consider fathers who do not want to get involved in child caring? That's a good question. And I think we know or assume in general that in a lot of places where such a package might be adapted, there is not parity in child raising and child care. I think, as you know, since this content is not really a program itself, it will be added to a program that will be working with communities. We wanted to give the package an opportunity to have that gender parity, to give the option to set norms, to model a more equitable child raising opportunity or child raising responsibilities. The package doesn't assign roles.
Mm-hmm.
Like men have to do this role in raising a child and women have to do that role. So there's no expectation that anybody has to fulfill a particular role as long as a child's needs are being met. I'll also say that I suppose that there's an option in the caring for the child, caring for the caregiver card. We show a lot of family support for the primary caregiver. So even if in a household, a father, for example, might not want to do that, there are other ways to support raising a child in, for example, in supporting the primary caregiver, which in this case would be the mother, by maybe removing her labor burden to focus on doing some of these development activities or child development or nurturing care activities.
Thank you, Andrew. I'm going to take a quick question from Claire and would also like to add to that before we wind up in this last minute. What we recognize that parents, including adolescents and young parents, are very time constrained. And so all these interactive activities that are recommended and suggested in the cards to promote nurturing care are what parents can do in their everyday moments at home. It doesn't require any special times, but it is like maybe before you put your baby to sleep, maybe while giving a bath. There are these little small brain development moments that can happen during the day in your regular day, and also requires really low cost, low resources. But speaking about adolescents, I would like to put in a plug for adolescent resource, nutrition resource bank. It is a repository of more than 200 documents on adolescent resources, including case studies, many briefs, as well as social and behavioral change materials. My colleague Medina is going to put in more information. She has already on the chat, and my colleague Sasha Lamstein, whose email is on the chat, is the one who would be the right person to go to. Also, keep an eye out. There is an upcoming webinar on the Adolescent Resource Nutrition Bank. So please keep an eye out for that. We also have USAID Advancing Nutrition has a landing page for early childhood, where a lot of our work bringing together nutrition, early childhood, and social behavioral change is. So I highly recommend you go to our website. The link is also on chat. And a big thank you and acknowledgement to all the technical advisory group members and the team from Advancing Nutrition, whose names are on the screen. Thank you.
Thank you so much for a wonderful presentation, very comprehensive. And I think you answered most of the questions here. You packed a lot of information and had a great video too. So hand clap for our second presentation. Thank you so much. Great. So again, if you have questions that haven't been answered, please, you could put a question in the chat. Some of the speakers said they'll be going back and checking the chats at a later date. So now we're ready to move into our final presentation. This is entitled The Effectiveness of Community Level Social Mobilization Intervention for Engaging Communities and Achieving Outcomes of Polio Vaccination Campaigns. Evidence from Core Group Polio Project, Uttar Pradesh, India. So our key presenter for this presentation is Manoj Kumar Chowdhury, who is a demographer at Core Group Polio Project in India. And we have two other folks that worked on this project, but Manoj Kumar is our key presenter. So thank you very much and welcome.
Thank you, Beth, for the introduction. So for project presentation, we have Dr. Roma Solomon, who is the director, and Jitendra Avle, who is the deputy director, and Reena De, she is a communication director for our Core Group Polio project in India. So today we will be sharing the findings of our study on the effectiveness of community level social mobilization intervention for engaging communities and achieving the outcomes of polio vaccination campaigns. So here we are using a case study of Core Group Polio projects. So we know that polio has been eliminated in India, and India is a polio-free country since 2014. So the social mobilization efforts of Core Group Polio Project and UNICEF and other partners, they contributed in the success of polio elimination in the country. So now I will briefly describe what is Core Group Polio Project. It is a consortium of US-based organization, we say the private voluntary organization. The project has operations in 7 different countries. In India, we have 3 implementing partners. Those are EDRA, CRS, and PCI. So we implement all our interventions through the local NGOs also. So basically, our projects attempt to engage communities and to increase the outcome of our polio vaccination drives. So we also say this polio vaccination drives as a supplementary immunization activities or polio rounds. So we execute all our intervention through multi-level network of mobilizers. So we have mobilizers at the community level, block level, and the district levels. So for our today's presentation is focused on this particular study objective to measure the effects of community level intervention. So I'll be using a word intervention only. So in community engagement and performance of polio vaccination drive during the post-polio endemic period. So when I say the post-polio endemic period, it refers to the time from March 2012 to September 2017. Now coming to the study design. So it is a kind of a quasi-experimental study design where we have a time series data. So we have an intervention area and non-intervention area. Intervention area is nothing but the area we deployed a frontline health worker, frontline mobilizers that we say the community mobilization coordinators. In short, we say the CMCs. Then the non-intervention area where we don't have a deployment of frontline mobilizers. So both the areas, they comes from a same geographic unit. So if you look at the location map of this particular study, so we have operation in 12 districts that covers about 58 blocks or polio planning units. So each block is having intervention and non-intervention area. So in intervention areas, community mobilization coordinators were deployed in polio high-risk areas. So it is to be noted that this study we are using data of 10 years only, and this core group polio project in India was introduced well before in 1999. So this is not a complete evaluation of the core group project. Looking at the profile of intervention and non-intervention area, they differ from the socio-demographic profile of populations. So in September 2017 that we consider the endpoint of this particular study, at that time, we were having about 11,000 CMCs covering 823 villages and reaching to about 522,000 households. Now we use secondary data from the project MIS, Management Information System. And that data includes coverage related information of polio SIS. So CGPP database provide information of on some of the indicators like number of children vaccinated at booth, number of houses visited, number of houses with missed children, and so on. So it is a kind of a cluster data where the occasions or the polio SIS related data is nested in the subject, or we say the block or polio planning unit. It is a highly balanced data. So we have not applied any sampling to select the samples for this particular studies. We included 56 out of 58 blocks. We purposely excluded 2 blocks. Those were not having operation for the entire study duration. And we included 52 SIS or polio rounds in this particular analysis. So when we say the polio endemic period, in this particular study, we refer the time before the March 2012 and the time between the March 2012 to September 2017, we consider as a post-polio endemic period. So we know that there are many definitions of community engagement. For this particular study, we attempted to define community engagement as a collaborative effort of Government of India, development organizations, that includes WHO, Rotary, UNICEF, and core group, community-based institutions, and community members to achieve the high level of polio SIA vaccination. So we applied different type of analysis to respond to our major research questions. So at the beginning, we computed indicators variables and constructed community engagement index. That is based on a weighted coverage of 5 set of indicators, 5 indicators representing to both the 2 component of polio vaccination round. In India, our polio vaccination round has a 2 types of operation. The first operation is the booth-based vaccination, followed by house-to-house vaccination. Then we also did some descriptive and graphical analysis to compare the performance of intervention area with the non-intervention area, we also perform bivariate multivariate analysis using generalized estimating equations methods. Then we assess the effect of this intervention using a different sensitivity analysis. And this analysis included interrupted time series analysis, then difference and difference method, then synthetic control method, which is nothing but the extension of difference and difference methods that estimate the counterfactuals based on the weighted values of intervention areas for the pre-intervention period. So in this case, our pre-intervention period was polio endemic period, that is the period before the March 2012. Now, coming to the results, if you look at this is just the example I am giving here of a community engagement index. So the first graph shows the actual and predicted coverage for two different periods. And the second graph shows the result of a synthetic control method based analysis. So in the second graph, you can see the blue line that shows the actual extent of community engagement in the polio SIS. So that has increased from over the time, it has increased. But if you see the broken brown line, it shows that if the CGPPs or core group polio projects, social mobilization intervention wasn't there, then the extent of community engagement would have gone down significantly. Now, looking at this particular tables provide the information on what is the treatment effect of intervention and the estimated counterfactual for all the study indicators. So if you take an example of a booth coverage, which is nothing but the percentage of children vaccinated at the polio booths, that's the fixed site vaccinations. So here we can see that there is a significant difference between the intervention and non-intervention area, but for both the periods. But the difference between this two period has increased over time. So in the polio endemic period, we had a difference of about 22%, and it has increased to 36% in post-polio endemic period. So the different methods to assess the effect of treatment effects in the range of 12.7% to 15.5%. So what does it mean? It says that if the CGPP's social mobilization intervention wasn't there, then the observed level of 82.8% of booth coverage would have dropped down in the range of 67.3% to 70.1%. So similarly, you can see results for other indicators. We can have a look at the another indicator, that is the refusal rate, which is nothing but which shows the number of resistance families among every 10,000 households visited by the vaccinators. So if you look at this particular number in the post-polio endemic period, the CLSM intervention area had a refusal rate of 2 resistant families among every 10,000 visited houses. If this particular intervention wasn't there, then these 2 resistance families would have increased in the range of 6 to 10 resistance families per 10,000 visited households. And similarly, you can see the community engagement would have also gone down in the range of 81 to 82%. Now, if you, we have seen the extent of effect. Now coming to the absolute number, if core group polio projects intervention wasn't there, then there would have been about 70,000 children, those who have not been vaccinated at the polio booths. About 314 additional houses would have remained resistant to the polio vaccination, and about 39,000 households would not have been engaged in each SIA of the post-polio endemic period. So these are the estimates I have given here. Now, to summarize the finding of this study, so we see that the performance of polio SIS significantly differ between the intervention and non-intervention area. And the absence of intervention in the CMC areas would have deteriorated the outcome of both the booth-based and house-to-house vaccination drives. Using the estimates of a disaggregate population of this study and annual incidence of paralytic polio cases, this study estimates that the core group polio project's social mobilization intervention was able to avert at least 43 paralytic polio cases annually from the CMC area, which is the significant contribution of core group polio project to the global polio eradication initiative. Since we know that the single case of polio, wild polio virus is considered as a public health emergency, we believe that this particular study contributes to the literature on the effectiveness of social norms or social mobilization intervention in public health. Our study findings are somewhat similar and supplement to the previous research. Now, the study has evidence of the deployment of community level paid volunteers, that is the community mobilization coordinators, was effective to address the access barriers and increasing the community engagement. This research suggests that the intensified social mobilization and social and behavior change communication initiative with the deployment of dedicated community level functionaries, like we had CMCs, can be useful to deal with the demand side barrier in the utilization of public health services. Our study finding recommends that carrying out intensive social mobilization efforts in the areas that is resistant, that has resistance to acceptance of accepting public health development initiative. The study learnings can be applied to other parts of the country or in other countries as well, where there is a problem of low acceptance to vaccination or any public health program. In Indian scenario, a policy decision can be taken to deploy additional social mobilizers or volunteers under the national health missions or through the other systems. Now, to conclude, this study findings suggest that intensive social mobilization efforts can significantly increase the extent of community engagement. The study provides evidence of added value of additional human resources dedicated to social mobilization, and the study findings can be applied to, study learnings can be applied to the other areas where there is a problem of low acceptance of any public health issue. So these are the references we use for this particular study, and those who want to know the details about this particular study can visit this particular web page, where we have a preprint journal article, and you can see our forthcoming article in Journal of Global Health. Thank you very much.
Thank you very much, Manoj Kumar, for a really incredible presentation with a lot of data that you were able to organize and assess impact, from secondary data. And I have not seen a study like this before that really looks at the data afterwards and is able to divide up components of social mobilization the way that you did. We've got a little under 2 minutes left, so it's not much time. If anyone has any question, please put it in the chat box. I guess if there's no other question, I'll ask something. I mean, did you think of this study before, like before you did it? I know this was 2017 data, but was it afterwards you said, let's go back and see if we can find the impacts, or did you have this intention ahead of time that you were going to actually go in and kind of break down the components of the intervention that could have impacted the results?
Yeah, that is the next step of our analysis. We will be doing that analysis.
So we've got some great comments here. Mariamu says, I hope we can use the social mobilization approach for COVID-19 vaccine. So other applications. Janine shares that the India polio story is a fantastic story of the power of community and social mobilization, and kudos to the core secretariat team in India. And I would add my congratulations as well for this study. And Kristen Mallory says thank you as well. And is this study going to be available? Did you put a copy of the link into the chat?
Sorry, that link I shared in my presentation, I will paste that link in the chat box.
That would be great. Yeah, we actually have just used up our time. So if you could go ahead and do that before people leave, that would be great. So I want to thank everyone for your participation. We had, at one point, I think I saw 50 participants in this call, which shows the interest in social and behavior change and all the different ways that we can understand barriers, real and perceived, to changing behavior. So thank you so much to everyone. And again, a final comment, if you are interested in kind of having your own copy of comments and links, you can save the chat box by going to the 3 dots. If you go to the bottom of the chat, it says, there's a rectangle that says file, and then there's 3 dots. If you click on that, it'll say save chat. So if you want to have your own saved chat, that you could have the links that way. So if there's nothing else, I want to thank all the presenters for your hard work and presentation of fascinating and very useful information that we can all hopefully adapt in our own work. So I think it's now time to go back to the main plenary. Thank you, everyone.